Well, every year it seems we hear about an outbreak of norovirus. This time it's on the West Coast and it is serious. Health officials are investigating if it contributed to the deaths of 9 people in a seniors' home in Victoria. Dozens more at the facility have fallen ill from the highly contagious bug. Staff have been hit hard too, and it's a new strain that's already spread across Washington state. Robin Gill reports.
An unexpected outbreak of norovirus has kept visitors away from the Selkirk Seniors Home in Victoria. 106 patients and 50 staff members have come down with this gut-wrenching stomach bug. 9 people have died. Though the cause of death has not been determined, it's believed the virus was likely a contributing factor.
People don't die of norovirus, they die with norovirus. That often they have many other medical complications and problems.
Norovirus is highly contagious. Symptoms include vomiting and diarrhea. But it's also highly unusual at this time of year.
It's no surprise that in, for example, a nursing home where you have people who are sharing a lot of space together and they're sharing eating habits, they're sharing dining practices, etc. And most importantly, their food preparation is done by 1 or 2 people. And this is a fecal oral transmission that you see outbreaks.
British Columbia's health regulations don't require that this specific virus be reported to the Centre for Disease Control. So there's no way of knowing how many people across the province may be affected.
What doctors do know is that it's a new strain called Sydney, which is also sweeping across Washington state, with 120 cases reported there.
Sydney is known to be a little bit more virulent than the other Norwalk viruses, absolutely. But I would argue you're right. I think certain practices around hygiene have definitely laxed a bit.
Earlier this year, 2 Vancouver area hospitals had to close wards when the virus struck.
Once you think that there's something going on there, you institute increased cleaning and disinfection. You put patients together, the sick patients together, keeps them away from the healthy patients.
At the Victoria Seniors Home, infected patients are isolated and all social activities have been canceled to prevent the spread.
There is no antibiotic that you can take, there's no vaccine, so it goes back to that old advice that our mothers gave us: wash your hands, wash your hands, wash your hands.
If only that advice had been taken early on, so many people wouldn't have gotten so sick and the facility would have been able to contain it better. Robin Gill, Global News, Vancouver.
Outbreaks of norovirus are relatively common in Canada. About 300 to 400 outbreaks are reported each year. The very young, the elderly, and those with weakened immune systems are hardest hit by it. There is no vaccine or antiviral drug to prevent people from getting sick, and as Robin reported, the best defense is to wash your hands.